Thank you, Oliver. Good morning. Good morning, all. So last year we presented at Ask About Asthma on and shared the fact that London was working on a proposal for a damp and mould checklist for housing. Today I would like to update you on the progress on the tool and its impact on identifying and tackling mouldy housing, particularly for vulnerable patients. Next slide, please. So generally, the drivers for growing concern about damp and mould are rising energy costs, which we know, and that's leading to rising levels of fuel poverty, and additionally, there is an increased focus on poor quality housing, of which London has a lot of, and that's in respect to insulation and ventilation. And I'm sure you are aware of the tragic and untimely death of Arab Ishak, and the causes being due to prolonged exposure to mould in his home. Next slide, please. So we know that mould can grow indoors, particularly in damp and cold and poorly ventilated environments. And to reproduce, it produces airborne particle spores, which when inhaled can cause irritation and lead to asthma attacks, and can trigger asthma attacks in some people. And we've heard from Izzy this morning that the quality of air that children and young people grow up breathing can be absolutely fundamental for their management of their asthma. We also know that exposure to risk factors such as damp and mould, and we've just heard from Professor Sinner, are starkly unequal. There is a stark inequality in terms of how damp and mould is distributed across houses in London. So the London picture, as it was at the start of this project, was that damp and mould related complaints were responsible for almost 1/3 of Category 1 hazards in London. And of these incidences reported, it amounted to twice the proportion seen across England as a whole. So we knew we had work to do. Next slide, please. So in 2023, a multi-agency, so we decided to work at system level. We knew that this wouldn't work at a borough level. It had to be done across all of London's boroughs, so we took a regional approach. And I worked with a group of fantastic colleagues from across the system: GLA, ADPH London, NHS, and UXA, UK HSA. So there was a collaboration to think about how we could devise a tool that would support the work of health and care professionals going into the homes of vulnerable people, and give them a tool that wouldn't add to their workload, because obviously our health and care professionals are very busy. They already have enough to do and very short timescales to be in patients' homes. So the main objectives were to help and support health and care professionals to recognise and understand damp and mould, and that's even if it were the smell of damp or the smell of mould, the smell of damp and obviously visible signs of mould, to support them with taking action to support those people. So in some cases, the patients knew that there was damp and mould issues in their home, in some cases not. So identifying, supporting patients by raising awareness, and also signposting them to support. Next slide, please. So the damp and mould toolkit was developed across over the early months of 2023, and keeping an eye on the government guidance, which we knew was going to land in September 2023. So we made sure that we were aligned with that. We decided the content should be focused on 3 areas: housing concerns, so where have any housing concerns been identified? Is there any visible sign of damp on the walls or ceiling? Is there adequate ventilation, windows with trickle vents, etc.? Assessing clinical vulnerability. So were the tenants of the houses at increased risk of damp and mould due to perhaps asthma, COPD, or any other lung condition? Were there any other instances? Did they suffer instances of wheezing or breathing difficulty? So that was a factor we felt that was really important to include. And section 3 was obviously taking action, signposting health and care professionals and the tenants themselves to resources that could be supportive, whether that be NICE guidance, shelter, citizens advice, etc. And within the appendix were template letters and fact sheets in order to quickly convey information. Next slide, please. So these are the sections I describe: identification, assessing clinical vulnerability, and taking action. Next slide, please. So we piloted the damp and mould checklist over with 8 London pilot sites until we went live in December 2023. It went live on MECLink because we felt that that was a portal that was already being used by many London health and care workers, and the downloadable resources would best sit in that location. So that went live in December. In fact, it probably went live in January because it was over Christmas. And within the space of 8 weeks was the most downloadable resource across all MECLink sites nationally. So there clearly was a hunger for this information. There was a gap. It was widely disseminated and widely shared, and then readily adopted. Next slide, please. So I could tell you in my words what I think the impact has been, but I think it's even more powerful to understand how our clinicians and health and care professionals have received this, how they've implemented it, and how they feel it's added, what they feel the impact has been to the way they work with vulnerable patients, and any benefit that has been achieved to date. So I'm going to ask the video is played. Thank you. I think there'll be a little lag until the video gets going. Here we go. So this is Richard Shabazz. He's a paediatrician.
Circulated the documentation around the team so that they know that they can use this, but most specifically with our asthma nurses, when they're able to do home visits, they can use this tool to help document the amount of damp and mould that's in the property, and then use the rest of the resource to highlight those concerns to all the other people in the system to help improve the situation.
So St George's had embedded this into their system and are continuing to do so. And Richard Shabazz was obviously just sharing how they'd gone about implementing it. The next video, which I'd asked to play, talks about the impact and gives a particular case study that St George's would like to share.
We had a 5-year-old boy who had recurrent episodes of wheezing, and even an admission to PICU and pediatric intensive care with a severe wheezing episode. We organised a home visit, and during that it was clear that the house or the property was or had an extensive amount of mould through the bedroom that he had to share with 4 siblings. We went through the documentation, and that was then sent to the housing association who run the property, and in this situation, then the family were actually moved out of the property into temporary accommodation whilst the housing association hopefully fixed the problem. And so I think that showed a direct impact from using the checklist and the support that goes with that.
So as you can see there, they can demonstrate that at St George's it's working. Other examples have been shared from other London boroughs in terms of adult care, where respiratory issues were the focus. And within weeks, I was hearing about other identifications of damp and mould in the home, people being supported in approaching their landlords and talking and finding resolutions, whether it be that they were removed from the home and remedial works took place, and then they were able to return to home. So it's fantastic that the checklist is not only being used, but is also delivering benefits quite so quickly. Next slide, please. So next steps. Well, the tool has been adopted much more widely than just London. It's caught the attention of our national colleagues, and they have asked if they could embed it in 2 national programmes. One is the Healthy Homes pilot programme, and that involves 40 local authorities, and the private rental sector pilot programme, which is an additional 9 local authorities. In addition to those, a number of areas, regions, boroughs have also come forwards and asked if they might adopt and adapt it for their region. So in particular, Cornwall were quick off the mark and have devised their own version, which is actually a nicer. It looks a bit nicer than the London version because they've spent a bit more money on it, but it is due to go live very soon. We are sharing case studies so that we can encourage and share the learning from across the regions, and so that other areas can go further faster. We are looking into and examining the role of technology and how we might be able to save even more precious clinical time, health and care staff time in assisting tenants in escalating issues. So if we can find a digital solution, that would be amazing, and we'll be focusing on that next. And we are looking at a formal evaluation at some point soon. So these are steps that we'll be taking in the coming 6 to 9 months, I should imagine. Next slide, please. So I look forward to your questions at the panel session. I believe this is the next speaker slide. So thank you so much for listening, and I welcome your support and endorsement on the use of this tool in your areas. Thank you.